been fighting anti-vaccine nonsense for the past 15 years, and the problem has been going on even before I became an official skeptic. Back in 1998, that's when Andrew Wakefield drew the blood of children at a birthday party with no ethical oversight, and then he used the results to terrify the world into believing in a non-existent problem. The idea that the safe and effective measles, mumps, rubella vaccine, MMR, causes autism. It does not cause autism. In the years since Wakefield published his study, that vaccine and many others have been extensively tested again and again, and each time have been found to have absolutely no connection to autism. Wakefield's study was retracted for fraud, he was discredited, and he fled the UK for Texas, where apparently his anti-scientific garbage is more tolerated. While there is no scientific debate over the fact that vaccines do not cause autism, there is an ongoing debate among science communicators over how we talk about the risks of vaccination. I've personally seen many skeptics fall into the trap of announcing that vaccines have always been and will always be perfectly safe. They're trying to combat the misinformation about the dangers of vaccines by going completely in the opposite direction to reassure the general public that there's no risk to them getting vaccinated. Unfortunately, that's not true. As much as vaccines are an unmitigated good for society as a whole, it is still possible for an individual person to be injured by them. Hiding that fact, I believe, will only make the general public distrust you when they eventually learn about these risks, which is why I've always appreciated documentaries like Jabbed by Sonia Pemberton, in which they discuss how safe and effective vaccines are while still acknowledging that sometimes they hurt people. Pemberton interviews people who have lost loved ones to adverse vaccine side effects. And it's so much more compelling to hear those people insist that getting vaccinated is still the right thing because the side effects are so rare and the benefits to society are so unbelievably great. I've been thinking of all this lately because COVID-19, of course. Had the United States reacted properly to the pandemic and actually locked down nationwide with strong leadership from the federal government, we would have saved thousands of lives and we could have had a mostly normal summer. Kids would be starting school right now in person without worrying about catching a virus that could leave them with a lifetime of heart problems or kill them or kill their parents or their grandparents. But we didn't do that because we're a nation of horrible racists who elected a reality TV star as president. So instead, we're living in this weird limbo where those of us who understand the science and who care about other people and who are able to stay quarantined, we do that while we watch the ignorant and the selfish and the essential workers go out into the world as though everything is fine. As though 190,000 people haven't already died in the United States alone, with about 40,000 new cases appearing every single day. It's a nightmare, like where you see the monster and nobody else does. And they just act like everything's fine, but the monster is about to kill them. So we wait for a vaccine because once we get a vaccine, we can hope that the people who aren't interested in socially isolating themselves or who aren't able to do so, they might still protect themselves and others by getting the vaccine. And we can ensure that we won't accidentally spread the virus further just by going to Walmart or whatever. Here's the problem. It's the same problem as before. The problem is Donald Trump. Because vaccines, like most modern science, takes time to get right. It takes years to develop a vaccine that is both effective at preventing disease and safe for the general public. Yes, there are always going to be the chances of rare side effects. But proper vetting means that we can avoid disasters like, for instance, the one that happened in America back in 1974. Rick Perlstein, a historian of conservative politics in the U.S., writes over in the New York Times that back in February of 1976, there was an outbreak of H1N1 amongst the soldiers at Fort Dix in New Jersey, of whom one soldier eventually died. Gerald Ford was up for election that year for his first full term after taking over from Nixon. And he was informed that this virus might be related to the one that caused the influenza of 1918. Ford was eager to look like a hero, so he announced a mass vaccination program, rushed to the American people by fall of that year. He pressured the World Health Organization to endorse the plan despite their initial skepticism, which they ended up doing. No other country rushed a vaccine through. They chose instead to wait and see what the disease did, which was the World Health Organization's initial recommendation. In the lead up to the vaccination program, researchers in the U.S. found that H1N1 was not, in fact, related to the 1918 influenza. A researcher at the FDA announced that the vaccine that was being developed was unsafe, and he was fired for insubordination. Drug companies working on the vaccines threatened to quit unless Congress offered them protection from any liability issues. Previously, they had also only agreed to begin work on the vaccines if Congress promised them that they could make a profit. Congress agreed to all of their demands. The result was that 45 million Americans were vaccinated with a rushed live virus instead of an inactivated virus that's normally used. 450 people developed a rare neurological disorder known as Guillain-Barré syndrome, leaving them paralyzed for life. Dozens of them died. Meanwhile, outside of the United States, there were no outbreaks of this disease and no one died. I should note that while researchers believe it's likely that the vaccine increased the risk of people developing GBS, the neurological disorder, it's not set in stone. Since after the first few cases appeared, doctors were biased to think that anyone who developed GBS got it as a result of the vaccine. So it's kind of hard to tease apart. But there's a very good chance that the vaccine did lead to people developing this disorder. And still, the damage was already done. Whether the vaccine caused that damage or not, the damage to the public perception of vaccines was overwhelming. Americans saw people contracting a previously unheard of, horrible neurological disorder. And then they also saw that people outside the United States were not at any risk of any kind of virus. There was no pandemic. There was no danger. H1N1 was able to be contained without the vaccine. And that is one of the big reasons why today only about a third of Americans bother to get their flu vaccine every year. Despite the fact that the influenza vaccine is extremely safe and can be extremely effective if enough people get it to build herd immunity. 35,000 people die from influenza each year, but they don't have to. If people just get the vaccine, which is usually offered for free through healthcare providers because it's such an effective vaccine that the insurance companies save money by giving you a free vaccine because they know that later they're not going to have to pay for your dumbass to go see a doctor. Even if you don't have insurance, you can get that vaccine for like $20 at your local pharmacy. Which is why, back when COVID-19 started picking up steam, I encouraged Americans who were worried about it to go get their flu shot because it's important. It's effective. It works. We already have the vaccine. And I had no idea at the time that messaging was going to be co-opted by people trying to downplay COVID-19. But here we are with people who still think COVID-19 is no big deal and who probably still won't be getting a flu shot this year. It's Infuriating. And that brings us back to Trump and a potential vaccine for COVID-19. Rick Perlstein writes in the New York Times that Trump can maybe learn a lesson from Gerald Ford and move prudently, not impetuously, in rolling out new vaccines for COVID-19. When I read that, I chuckled at Perlstein's optimism, but I pretty much lost it at his closing words, which were, Jerry Ford's Hail Mary didn't work after all. He lost to Jimmy Carter anyway. That's a history lesson even Donald Trump can understand. Perlstein is a smart man, but dear Lord, I don't think that there's any lesson so simple that Donald Trump can't misunderstand it or completely ignore it. Trump himself has already cast the FDA as the deep state and said that they are purposely going to try to delay a vaccine until after the election, just as a personal slight to him, because everything is about him. All of which leaves me in a really interesting position. After 15 years of fighting unwarranted vaccine skepticism, I am skeptical of a COVID-19 vaccine. I do trust people like Francis Collins, for instance, director of the National Institutes of Health, who insists that nothing is being done here to compromise the safety of COVID-19 vaccine trials, nor will we compromise on an ultimate conclusion about whether the vaccine is effective. Those issues are going to be tested in the most rigorous way. But I don't trust Trump, his administration, or the federal government's ability to stop a politician from acting selfishly in the face of a presidential election, especially when that politician has demonstrated fascistic tendencies and a disregard for human life in the face of his own ego. I'm not saying that you shouldn't get the COVID-19 vaccine when it eventually is introduced to the general public. I'm just saying that we should do what Gerald Ford should have done in 1976. Wait and see. Trust the experts when they speak out. And in the meanwhile, please get your flu shot. It's out now. It's safe. It's effective. It will prevent tens of thousands of deaths on top of those that we're already experiencing during this pandemic.